Departemen Ilmu Kesehatan Masyarakat Kedokteran Pencegahan, Fakultas Kedokteran Universitas Airlangga mempunyai peran untuk membekali calon dokter sebagai care provider, decision maker, komunikator, community leader, dan manager serta researcher yang akan sangat diperlukan oleh profesi seorang dokter. Pendidikan ini kami berikan mulai tingkat preklinik dan profesi. Tantangan yang harus dipertimbangkan adalah kemajuan teknologi. Dalam hal ini, seorang dokter harus mampu beradaptasi dengan kemajuan teknologi, sehingga pendidikan di ilmu kesehatan masyarakat kedokteran pencegahan juga bisa menjembatani untuk mendapatkan kompetensi itu. Departemen kami selalu bekerja sama, baik itu tingkat nasional maupun internasional, dalam pengembangan IT untuk mencapai pelayanan pada masyarakat secara paripurna.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
It's a great honor to welcome the honorable speaker, Prof. Roting Lin from China Medical University, Taiwan, Engineer John Budi from Jakarta, Indonesia, Dr. Puji Lestari from Universitas AIRLANGGA, Indonesia, and Dr. Linda Dewanti from Universitas AIRLANGGA, Indonesia. Good morning, ladies and gentlemen. Welcome to the first webinar hosted by Department of Public Health and Preventive Medicine, Faculty of Medicine, Universitas AIRLANGGA. The topic is preparing workplaces for COVID-19. First of all, allow me to extend my warmest welcome to you all to this webinar. My name is Adhikara. I will be the master of ceremony of today's webinar. With this webinar, we will have a wide knowledge about preparing workplaces during the pandemic situation. The excellent speakers will share their experience and knowledge regarding this matter. This webinar will be done by 2 languages. The first speaker will present in English and the rest will present in bahasa. Oke, saya selanjutnya akan menggunakan bahasa Indonesia. Bagi semua peserta yang akan mengajukan pertanyaan, harap meninggalkan pertanyaan pada chat box di aplikasi Zoom, dan kami akan memilih 5 pertanyaan yang akan dijawab secara langsung oleh para pemateri di sesi diskusi atau di akhir nanti. Mengenai sertifikat, telah kami sediakan di Zoom chat, ada Google Form link di situ, bisa di-download masing-masing. Lalu mengenai rundown acara, hari ini tepat pukul 9 kami akan memulai dengan nanti materi pertama akan disampaikan 5 menit lagi dan akan ditutup dengan sesi diskusi pada pukul 10.35, pada pukul 11 nanti hingga selesai. Ladies and gentlemen, I would like to proceed to our main agenda for today for the webinar. This session will be led by the moderator, Dr. Sulistiawati. She is the head of the Department of Public Health and Preventive Medicine, Faculty of Medicine, Universitas AIRLANGGA. So now I have the pleasure to hand over the session to Dr. Sulis. The time is yours.
Thank you, Dr. Pagan Pratama. Good morning, all participants of this webinar, and special regard for our keynote speaker. Today we have 4 keynote speakers. Professor Rotin Ling from China Medical University, Taiwan, Dr. Linda Dewanti from AIRLANGGA University, and Dr. Puji Lestari from AIRLANGGA University, and the last speaker, Engineer John Budi. He is engineer practitioner of HVAC Industrial. So let's before we start this webinar, maybe based on the topic of the webinar about preparing workplaces for COVID-19. We know that Indonesia have incident of COVID-19 very high, start from February, March 2020 until now. Incident of COVID-19 increased, and also increasing with new cluster of spreading COVID-19, such as in office, hospital, and public places. Indonesia have regulation to prevent the spreading of COVID-19 with the health protocol, but the incident still high. That's why that may be it because of the people behavior not so compliant, or there are many factors that we have not yet controlled, like control ventilation, air circulation, and etc. Therefore, in this webinar, we will discuss it all aspects from policy of government, preparedness workplaces, and practice to control ventilation and air circulation. Okay, because all keynote speakers have been joined with us, is that right? So let's start with first keynote speaker, Dr. Rotin Ling.
Hello, nice to meet you. Thank you, Dr. Sulistiawati and Dr. Adhikala's introduction. So good morning. My name is Rotin Ling. Thank you for giving me this opportunity to share this topic with you and also participate in this important webinar. First, I'd like to have a declaration. I'd like to declare that I have no conflict of interest in relation to this presentation. And this is the outline of my presentation. Following this order, I'd like to briefly introduce how Taiwan combat COVID-19. And I believe you have, some of you may heard the story in Taiwan. Second, I'd like to introduce the concept of governance. Governance really matters in this situation. When we fight COVID-19, governance is very critical. And recently, one of my research was published. It's about a cross-country comparison among 62 countries. And among this, in this paper, I introduced the concept of governance. Basically, we found that countries with better governance, they can fight COVID-19 better. So that's my, my recent research I'd like to share with you. Finally, how can we learn from country experience to the company? And I work in one of the largest semiconductor manufacturing company in the world, TSMC. And at that time, I was helping the company to fight H7N9. So I'd like to share the key concept we were doing to prepare workplace disease prevention. Okay. So at the beginning, I'd like to draw your attention by showing this figure. This is a temporal trend of daily new cases of COVID-19 in Taiwan. When COVID-19 first appeared in China in late 2019, last year, it was predicted that Taiwan would be one of the most affected countries. But you can see from this curve, yeah, there were some cases in March, and then there were very limited number of cases, and most cases after April were imported cases. So, but at that time, white people thought that Taiwan was most vulnerable. This slide shows our geographic proximity to China. We are so close in terms of geography. Second, people-to-people exchange between Taiwan and China are very frequent. When disease continue to spread around the world, Taiwan has been able to contain pandemic and minimize its impact on people's daily lives. And so I'd like to share what have we done. And this slide shows the most updated number of total cases up to yesterday. And you can see that as of yesterday, there are 510 total cases during this period, and most are imported cases. And among them, only 7 deaths and 480 cases, or 94% of these cases have been recovered. How does Taiwan beat the COVID-19? To fight against the COVID-19, we can adopt different approaches. And this slide, I want to show you the key element of preparation, detection, and control of COVID-19 in Taiwan. First, we need a central team. The government integrates several resources from different sectors, including the public sectors, private sectors, and medical sectors, as well as academic sectors. In this year, on January 2nd, the response team of Taiwan was set up very early. You see, in January 2nd of this year, Taiwan CDC has set up a response team to respond. At that time, it was a mystery pneumonia epidemic in Wuhan, China. But at that time, our government has set up a response team. In the meantime, the global epidemic situation was getting worse. 2 weeks later, just in 2 weeks.
Taiwan kemarin kayak mana dia control COVID-19.
Okay.
Ya kan ini mereka kan satu pulau gitu.
Kecil lagi ya kan.
Gampang aja mereka tuh kayak pulau
I heard somebody was want to share some perspective.
Kalimantan besar.
Jawa Timur paling.
Iya, paling segitu dia.
Gitu Jawa Timur, dah habis itu tutup, nggak ada boleh masuk udah.
Oh, so can I continue?
Gimana? Iya.
Okay.
Baru
So
satu
anyway,
pulau
2
tuh nggak
weeks
bisa
later.
menghidupi pulaunya sendiri.
2 weeks
Contoh
later,
kayak
on
Jawa,
January
kayak
20,
nggak punya
the
beras.
Central
Beras dari
Epidemic
Jawa.
Command Center, CECC, was
Jawa nggak punya.
established. Later on, the president of Taiwan appointed the Minister of Health and Welfare as the commander to coordinate and mobilize resources across ministries and private sectors to fight against COVID-19 together. So my first point here is, if you want to combat COVID-19, you need a team. If you want to combat the disease in a company, you also need a team. So from Taiwan's situation, we formed a small team at the very beginning. Later on, we realized it's a very severe situation. So the president announced a central team. So after the center was established, legislation is one of the most important instruments for government in organizing society and protecting citizens. It also sets standards and controls to govern the action of people. Like you have a team, but you need power and standards for people to follow. Then legislation is important. In Taiwan, we have Communicable Disease Control Act. And under the team, the center, and also the act, the below, I summarize the key successful strategies that we launched over the past months, including PPE, personal protective equipment, stockpile and allocation of PPE in Taiwan. Second, border control, and then the development of vaccine, government support vaccine development. And here, these three are more toward to prevention side. Then we also need surveillance and diagnosis so we can detect potential cases earlier. Then this is, we also need medical system and response preparedness. So workers in medical centers or clinics, they may be more aware of some cases. So everybody should mobilize and engage in this important work. Finally, some people were infected. We need to manage these cases. And here, I'd like to just give you some story about how we successfully manage or provide personal protective equipment. And this is one of the most successful story in Taiwan. Taiwan actually gained a lot of experience of fighting these, such kind of communicable diseases in 2003. It was SARS, S-A-R-S. And we had accumulated a pre-stockpile N95 respirator, surgical mask, and protective gowns for medical and public health personnel in response to emergency crisis at that time. And so the government wrote in the act that medical and public health workers can, the institute should provide enough PPE for those workers. So during this time, the COVID-19 outbreak, the government of Taiwan has already implemented, has already some number of PPE. And the government implemented a special policy. We ban export of masks to other countries. So in Taiwan, we have enough number of PPE for medical healthcare workers and public health workers. And it was to ensure enough medical masks for medical workers working on front line because they are most vulnerable and those workers can protect themselves. And because of the SARS experience, the general population of Taiwan also has the awareness and get used to wear masks to protect themselves. I don't know how the situation in Indonesia, but here in Taiwan, everybody is used to wear masks. But there will be a problem. If everybody wear a mask, how can we get enough number of PPE? We have 23 million population. So if we don't produce enough number of PPE, then we can not protect ourselves. Later on, the government of Taiwan organized, that's what I say, through this team and the president order, we formed a national team to produce masks. Through this integration, we can increase mask production as well as assist get some equipment to produce masks and some raw material to produce masks. Finally, and we can distribute our mask to all our people. And I like to show you that this, in Taiwan, everyone can receive a package. It's like an envelope. And inside that, there are masks. How can we get that? Everybody is entitled to get that. If you have your national health insurance card, you go to the pharmacy or convenience store like 7-Eleven, you can purchase it very free. And you can purchase this pack every 2 weeks, and you can get 9 pieces of mask. So this is a successful story because of governance, and we have a team, we have law, and we can take this kind of strategy easily. And in addition, the government also supply the public with 95% alcohol for this disinfection. Disinfection is also important. And I took this picture in this morning. This alcohol, there are 2 types, okay? And anyway, they are government supply 75% alcohol to the general public. So we can purchase this kind of alcohol at pharmacy, convenience store, supermarket, and hypermarket. So the point is that you need to have a policy and a strategy to distribute those PPE and some material for people to protect themselves. And because we have this center, in addition to launch several strategies, we can do risk communication. Risk communication can be done well, especially for health education, to teach people how to wear masks correctly, right? If we have masks, but people cannot wear correctly like this, they cannot protect themselves. So risk communication can be done through this center. And Taiwan implemented this strategy and measures, preventive measures, transparently and honestly. Taiwan demonstrates a democratic model of excellence in fighting the disease. And all these factors I show on the slide can provide a reference for you. All these factors contribute to a successful disease prevention and control in Taiwan. And overall, the capacity of implementing this strategy represents good governance of a country. Since governance of a country is so important, what does governance represent? Governance represents the characteristics by which a country manages its authority. It covers these following 3 aspects. First, the process of selecting, monitoring, and replacing government. Second, the capability of effectively formulating and implementing sound policies. Third, the respect of citizens and the country for the institutions that manage their economic and social interactions. So government influences the design and the implementation of health-related policies, as the circle shown in this slide, in the middle circle in this slide. And government can mobilize and coordinate stakeholders to realize common goals. So in my previous example, Taiwan government mobilize and coordinate different sectors, public, private sectors, and we establish health policies. And our common goal was to provide health, to fight COVID-19. So that's our, the concept. So therefore, good governance lead to good public health policies and actions, which may ultimately contribute to public health. Similarly, preventive actions proposed by country government have determined the spread and duration of the spread of the epidemic. For some countries, implementing preventive action can be successfully carried out, and the disease can be controlled. However, we should be aware of human rights concerns when excessive use of force and restrictive measures. So again, I like to reinforce this concept because government has the power to do many things. Of course, the ultimate goal is good to protect people's health, but sometimes we need to be aware of human rights. So during the COVID-19 period, the WHO and some international organizations has raised this concern. As COVID-19 cases surged during the early stage of the epidemic, some countries adopted extreme measures to stop the spread of disease, and it raised human rights concern. The UN Office of the High Commissioner for Human Rights urges countries to pay attention to respecting human rights and protecting vulnerable people. These are fundamental factors to success of public health response and recover from the COVID-19 pandemic in the long run. So I think that responsible government represent a responsive government, especially in more democratic countries, where citizens are empowered to voice their needs, participate in public affairs, and request the government's responsiveness. In the case of Taiwan, people ask the government, okay, you ask us to wear PPE, how can we get PPE, right? So the government is responsible for this request and provide PPE. And the mask is now available to everybody in Taiwan, including foreign workers in Taiwan or foreign students in Taiwan. They can purchase masks easily. Since governance is so critical in controlling the spread of disease and protecting human rights, and I want to know where over the past few months, would different models of governance in different countries that drive collective actions in response to the COVID-19 epic lead to different consequences. So we collect data from the world we collect 62 countries' data, and we link the association between governance, countries' governance, and the trend of COVID-19. And this is the work I talked with you that it has been published just last week. So in this paper, we